Hi, I'm Fernando Ferrer. I'm the Chief Operating Officer of the Kravis Children's Hospital at Mount Sinai, but I'm also a practicing pediatric urologist within the Department of Urology, where I'm senior faculty.
Hi, I'm Erin Miller. I'm the nurse practitioner in the Department of Urology in the subspecialty of Pediatric Urology.
So voiding dysfunction as you'll hear, is a common condition that oftentimes present to primary care providers or family practitioners, and really comprises a large portion of the population seen by pediatric urologists. So to date, there hasn't been a really robust, comprehensive voiding dysfunction program in New York City. And that would be a program that encompasses not only all of the diagnostic modalities, but also the treatment modalities, which you'll hear about, like biofeedback and so on and so forth. Our program is unique in the sense that we take a multidisciplinary, comprehensive view, and we can manage all of the aspects of voiding dysfunction, either ourselves or through consultative services with our colleagues in nephrology, for example, or general surgery or gastroenterology, because oftentimes these children have more than a urinary problem associated, as well as issues of neurologic concerns through neurology or neurosurgery, because some of the times these children have specific neurologic issues as well.
Well, as children become continent around the age of 3, sometimes a little younger than that, voiding dysfunction can present itself around this time as they learn certain behaviors related to voiding. And, it's fairly common. We see it between the ages of 3 and 10, and it happens in girls and boys, but we do more commonly see it in girls.
So the goals of treatment, to some extent, are specific to the patient's problems. While there's an underlying disorder, the children may manifest with different symptoms. So, for example, in some children, recurrent urinary tract infections are the problem. So managing their issues such that they diminish the rate of urinary tract infection, or in some cases incontinence is the problem, or daytime wetting, managing their condition so that we eliminate those problems. Oftentimes there's significant issues related to bowel function, such as constipation or holding, and managing their condition and treating them to eliminate those problems can be an objective. So in summary, whether it be diminishing urinary tract infections, improving daytime continence and voiding habits, or bowel habits, are sort of the high-level goals of a program like this. To be frank, sometimes we do discover that children either related to or caused by have some psychological issues, and oftentimes we seek to support children through this by contact with our psychology colleagues, or if we find any other associated issues like neurologic issues, we obviously seek to, once identified, to get them appropriate treatment for that.
We offer many treatments. The treatment plan usually involves many things, including time voiding. So we'll have the children void on a schedule every 2 to 3 hours, depending on their age. We will have them do pelvic floor relaxation exercises at home as well as in the office. And we offer computer game-based biofeedback. And that, eventually helps the children learn how to relax their pelvic floor. And we have them do that at home as well. There are medications that we use as well sometimes. And, we work with the children for many weeks to kind of improve these, the voiding dysfunction habits.
Well, I think there's a couple of things. As I mentioned before, there's been a lack of a comprehensive program in the New York City region. And I think the fact that Mount Sinai has made the decision to develop this program in a multidisciplinary, comprehensive way, and invest in growing it is unique in our marketplace. I do think that there are some things about our program that differentiate it. We have practitioners that are very experienced in this condition, and in fact have conducted substantial research and published in this area, which I think is a differentiator for us. We have, care providers that are very dedicated and very knowledgeable about this area. We also have care providers that function at very high levels in our national societies and international societies, and have access to really the latest and greatest thoughts on treatment, and actually have experience even conducting experimental treatments or research-based treatments for some of these children. And then I would say that the last thing is, in an academic institution like ours, another one of the benefits is that by having your child seen here frequently, there is the opportunity, although it's not required, to become engaged in some of our research programs. And we have ongoing research in this area, trying to, in particular, aid with the diagnostic tools. So I think the fact that we have multiple physicians in multiple areas, including radiology for the diagnostic work, and the other consultants readily available and fully engaged is also unique to our environment. Again, it comes from the commitment to take a programmatic approach. So it's one-stop shopping for the family. Once they're in the program, access to whatever they need is readily available. They don't need to, on their own, seek out individual doctors and other specialties.
We collaborate closely with the other specialists at Mount Sinai and outside of Mount Sinai, especially with the children's primary care provider, with their nephrologist. They have one neurosurgeon, neurologist, and even gastroenterologist. So, we will update the different specialists on the patient's progress and treatment and goals, and our plan of care. And we're easily accessible via email if you're within Mount Sinai, or calling me. And I do give out my card to all of my patients, so we're in close communication with the other people.
I think that we are making a very concerted effort to grow and expand our pediatric urology program. We now have 3 experienced pediatric urology practitioners. We have one very experienced advanced practitioner. We're bringing on another advanced practitioner. And we've invested and continue to invest in all of those diagnostic and therapeutic modalities, whether it be developing a very sophisticated urodynamics program, or investing in the technology to be able to do pelvic floor rehabilitation through biofeedback, which is a non-invasive way and a non-frightening way to help these children. The program is growing rapidly and is very much bringing to bear best care for these kids. We also have a specialized nursing team within Kravis Children's Hospital that continues to focus on patients with urologic concerns. Our radiology team and access to radiology imaging continues to improve. And then I think at the end, what I would share with you is we have a real commitment to family-centered care, and it's very gratifying for me to see this in our patient satisfaction data that talks about how accessible we are. Many times the patients get our direct ways to communicate with the physicians or advanced practitioners directly through texting or even through cell phone, depending on what the situation is. So I think that we're really bringing together a great team, but really staying focused on support of the families and family-centered care. So I think that referring providers would be pleased to hear back from their patients about how satisfied they are with their treatment here. We also communicate very much so with the referring providers and keep them engaged, and they're part of the treatment team.
They can easily refer a few ways, by directly contacting me, or they can call our office. I'm very much available via email, and I have a phone number as well, but my email is my first name dot my last name at mountsinai.org, and I'm happy to direct any referrals to our department. And then our office number as well is another good way to, refer a new patient.